So we're now going to talk about healthy bladder tips. We know that sometimes bladders can give you symptoms such as urgency, where you have to dash to the toilet quickly, and sometimes you may leak on the way. If these symptoms apply to you, then it's a good idea to try and get those symptoms under control. And sometimes you may experience these symptoms after your surgery as well. So these are our best bladder tips that hopefully you can use to help your symptoms now. So first of all, bladders should be able to comfortably hold 300 to 400 mils. It's a storage organ, so your bladder will start to fill up and then it will start to give you sensations that you need to have a wee. Most people wee anywhere between 2 and 3 hours, and these should be good volumes. If you find that these volumes are quite small, make sure that you're drinking enough. So you should be drinking 1.5 to 2 litres every day, and not just other things that might irritate your bladder. So try not to drink just caffeine, alcohol, fizzy drinks or fruit juice. We know that in some patients these can exacerbate and cause urgency symptoms. Make sure that you empty properly as well. So when you're sat on the toilet, give yourself enough time for your bladder to empty fully. Some people find that they may need to start to introduce a little bit of rocking, just to make sure that their bladder can tip and empty everything that's in there as well. We suggest that you, if you feel that you've got these urgency techniques, there are 4 things that I tell my patients that you can do, and again you can start these now. So the first thing, if you get that sudden urge out of the blue that you need to have a wee, try distraction. So think about something else, and think about what you've got to do this afternoon, or have a little walk outside away from your bathroom, walk away from the toilet, and that will help distract you. Most bladders will work on kind of like a contraction, and then the urgency will pass, so that a sudden urge that you're feeling will ease eventually. The next thing you could do are your pelvic floor exercises. So try some short squeezes just to try and override that really strong urgency that you can feel. And if you're stood up, sit down, you may feel this gives you more control. The next thing you can do is apply a little bit of pressure to your perineum, and that's the bit between the vagina and the back passage. We know that applying a bit of pressure to this area can override that really strong urgency feeling you're getting. So you can either do this with your hand, or you can cross your legs really tightly and wait for that strong urgency feeling to go. And the 4th thing you can do, my patients tell me that going up and down on your toes quickly in a sitting position again can help control that really strong urgency feeling.